I would like to inform all the members of the media that yesterday we had informed, after you had inquired regarding the number of cases affected by the new variant of COVID-19, that is Omicron. I would like to further add on what I had already informed the members, that the particular case which we had mentioned was a tourist from Assam. He had reported at Umling on the 21st. The sample was taken on the 21st of December 21, and while he was proceeding towards Shillong, awaiting the report, halfway, due to urgent work at home, this particular person, who is a 13-year-old from Assam, along with his parents, had returned back on the same day without reaching Shillong, and the place where they had booked for their stay in Shillong was at Langkating, one of the guest houses at Langkating. This particular person, along with his parents, never stayed at Langkating since they returned back on the same date itself, even before reaching Shillong. Now, the genome sequencing was done after the report was received, where he was found to be positive, and he was found to be infected with the Omicron variant, and that was reported yesterday, the 4th of January 2022. So now we have informed that there are 5 cases. So we don't have 5 cases, that has been pre-transferred. We have informed our counterparts in Assam. Now the number of cases which we have found to have been infected by Omicron in the state is 4. And out of this 4, as we have already informed, 2 are from Ribhoi district, and they have already recovered. They were COVID positive, they were isolated at home, and in the course of that isolation, their time period has been completed, and now they are well and have recovered and can go about their duties normally, without forgetting that the precautions, the SOPs as laid down, are to be followed strictly. The case which we had mentioned as Happy Valley, ARC Happy Valley, this particular patient also had recovered. Patient had come from outside the country, from Qatar, working there, and had tested positive on the 29th. Genome sequencing was done, and we received the report yesterday, the 4th of January 2022, and she was found to be positive for the Omicron variant. This particular patient also has recovered, He was initially isolated at home. Then we had, on her request, we had shifted her to the Corona Care Center, one of the Corona Care Centers, and she will be discharged by tomorrow or the after tomorrow. There is only one case left, which is an active case infected with the Omicron variant. In that particular case, as has already been informed, is in Naimukra under isolation, strict isolation, and there are no symptoms. The patient is doing very well. As of now, we have got 4 cases in the state infected with Omicron. 3 have recovered, so there is no need to be alarmed. And 1 is still active under strict isolation and doing well. Once again, I will reiterate, doing very well, and we are very confident that the patient will come out of this and recover. Now we would like to also inform that we have COVID-19 from 2020, early part of 2020, and in the course we'll have many variants. But the most important thing is that the precautionary aspect is always the same. And the restrictions being imposed is taking into consideration the transmissibility of the virus, which is very fast. And if we follow strictly the protocols as laid down, that is the basic ones: the mask, the social distancing, and sanitizing frequently, I think we have nothing to fear about. But the most important aspect of this virus, which may affect us, is the panic. So without creating any further panic, we would like to also inform that in the course of the COVID-19, the second spike which had happened in the state, there were a lot of restrictions which were let down gradually, and we have seen that with the gradual let down of the restrictions, we have also emphasized that the protocols are to be maintained strictly. So in the same manner, if we do not maintain the protocols strictly, then it will only call for further restrictions if necessary. We do not wish that there are further strict restrictions, but if the situation so demands, then we have no other alternative but to suggest for such restrictions. As of now, our appeal to the citizens of the state is that the protocols, if we follow the protocols strictly, then we know that we can arrest the spread of the disease. There will be many variants. Remember, the precautionary measures are the same. And if we can take ownership of this particular disease, then like any other disease, we can take care of ourselves, we take care of our family members, we take care of our friends, we take care of our neighbors. So it all depends on us, on how we deal with the situation, and it depends on us whether we can arrest this particular spread or not. Our appeal once again is that the protocols to be followed strictly, and